My name is Tara. I'm going to go ahead and administer an enema to my patient. First I would check the doctor's orders to see what type of enema needs to be administered, because there are a few types of enemas that can be administered. Next I'm going to gather my supplies. I have a bedpan. I have a towel to lay down underneath the bedpan just in case there's anything that spills. My enema bag, some tissues, and my gloves, and also my lubricant. I'm going to go ahead and knock on the patient's door and enter the room. I'm going to do hand hygiene. I'm also going to check my patient's identifiers previously, and I had already done that. I lowered my railing and I put my checks pad down. I'm going to explain to my patient. I'm going to give them an enema today just to help with some discomfort that they're experiencing. I will go ahead and have them roll over on, or I would put them in a left Sims position, and I would bring their right leg slightly over their left leg, and I would also expose the buttocks. Next, I am going to fill my enema bag up, and it's going to be tap water, 100 to 105 degrees. You can test that either with the thermometer or on your hand. And I'm also going to fill the bag 500 to 1,000 milliliters. Next, I want to expel the air out of the enema bag. So I just go ahead and do that right into the bedpan. And I'd release the clamp and just kind of let some of the solution flow freely out of there. And close it just until I see the bubbles that were in it that had exited out through the tubing. Next, I'm going to do hand hygiene. I'm going to don my clean gloves. Before this procedure is done, you always want to check to make sure your patient needs to, if they do need to use the restroom and void at all, you can definitely help them with that before you do the procedure, just so they're a little bit more comfortable. I'm going to lubricate the tip of the enema. Actually, I'm going to lubricate it down to 4 inches because that's how much you are going to insert into the anus. Next, I'll bring my enema bag over. I'm going to pull the gluteal fold up to expose the anus. I'm going to gently insert it into the anus. As I'm doing it, I'm going to have my patient take a deep breath, and I'm just going to insert it slowly towards the umbilicus, and never force it. That will cause a lot of pain and discomfort. So that is in. Next, you want to take the bag and hold it 12 to 18 inches above the anus, and go ahead and let the solution flow freely in there. It takes about 5 to 10 minutes before this bag is emptied. Okay, and that is complete. And if your patient does feel any discomfort or pain while you're doing this, you can always close the clamp and let them breathe a little bit and take a little bit of a break, and then continue the procedure. Next, I'm going to remove the enema tubing out of the anus. When I'm doing this, I'm going to have my patient take a deep breath, and I'm just going to slowly remove it. Okay, and then I'm going to go ahead and dispose of that. And then I'm going to assist them onto the bedpan. And then you do want to make sure they have some tissue there. Their caulite, leave them in a Fowler's position as well. I would just right away or immediately assist them too after they have their bowel movement, because that should happen fairly shortly with any cleansing of the anus or buttocks area after they're done. I would remove my gloves. I would provide for hand hygiene, and I would document the procedure and any difficulties and how the procedure went.
My patient an enema today. So what I did first was I checked the physician's order just to see what kind of enema to give, and I got all my supplies here. So the next thing I would do is I would enter the room, knock, and I would introduce myself, and I would say, "Hi, I'm Katie. I'm here to give you your enema to help with the discomfort you're having with your bowels." Then I'm going to lower the railing. I don't know how to do position like she currently is, with her right leg slightly over her left to expose the buttocks, only exposing the area I'm working with to provide the most privacy. And I have my chucks laid here to, if anything were to accidentally spill on the sheets, to protect the sheets. So now I'm going to get my enema ready. So I have my enema kit, and I looked at the doctor's orders to see that I need 500 to 1,000 milliliters of normal saline, and the temperature of the water should be about 500 to 1,000, 100 to 105 degrees. Alright, so I filled this up, and next thing I'm going to do is I'm going to let some of the water out, because I need to have, I need to get all the air out of here, because any excess air into the anus would cause discomfort and bloating. So I let it out to get all the bubbles through. Alright, and the next thing I'm going to do is I'm going to lubricate about 4 inches on the end here, just to make sure that it slides easily into the anus. So next, I'm going to wash my hands. Wash my hands, and I'm going to put on my gloves. Alright, so I'm ready to do my procedure. Everything's set up and ready to go. So next thing I'm going to do is I'm just going to expose, I'm going to lift the gluteal fold here, and I'm going to insert it into the anus. While I'm doing that, I'm going to have my patient breathe deeply to help with the discomfort, and I'm going to slowly twist and turn, entering it about 4 inches. I'm going to slowly release the clamp and let the solution flow into the anus slowly at first, and I'm going to ask my patient if she's feeling any discomfort or anything like that, just in case I need to stop the procedure. And if she's feeling okay, I'm just going to let it flow into there. And it's going to take about 5 to 10 minutes. And then when it's done, I'm going to take it out of there. I'm going to tell her to deep breathe once again, pull it out of there, and I'm going to dispose of this into the garbage. And then I'm going to assist my patient onto the bedpan. So I'm going to help her onto here, and I'm going to put her in a Fowler's position, or help her into a Fowler's position. And then I'm going to give her the call light and make sure the head of her bed's up. And I'm going to give her a call light, take off my gloves, perform hand hygiene. And I'm going to tell her to call me when she's done. And then when she's done, I'd enter the room, wash my hands, put on new gloves, and I would help her off of the bedpan. And I would inspect to see what she expelled, and I would help her clean up if necessary. Then I would take off my gloves again, wash my hands, get rid of this, and then I would go and I would document everything, the procedure I did, how the patient tolerated it, what I found, what happened, if the comfort level's okay, and I would make sure she's comfortable and she had her bedside railing, or the call light bedside railing up and the bed lowered.